I knew if I ever started a YouTube channel, my first video would be on this. I've seen 8 patients today, and all of them have been on this medication for many, many years. 6 of them didn't even know why they were on it, and they don't need to be on it. And that's not the crazy part. The crazy part is all of you will be off this medication at some point in your life, and likely be on it long term when you don't need to as well. And the scary part is this medication is deemed very safe, and that's not true. It can give you significant side effects, and these get worse, and the risk of them gets higher the longer you take this medication. So my name's Dr. Ahmed. I'm a GP. I've been practicing for the last 15 years, been a GP for the last 5 years, and I'm based in England. And one of the biggest things I see in people is being prescribed medications too often or too early, and then getting stuck on them for many months or even years where they don't need to. And none is more so true than this medication. And this medication is called omeprazole or lansoprazole or any proton pump inhibitor. Now, I think we're in this sort of crazy perfect storm for this to happen here in the UK, but I think it matters worldwide as well, where you can only see a doctor for often 10 minutes, often less than that. The doctors are rushed, no fault of their own, it's a massive system problem. But also, when you see the doctor, they've probably never met you before, and the next time you see a doctor, it'll probably be a different doctor. So this means the doctor you're seeing doesn't really fully know your history, doesn't really know why you're on the medication, and often is in a rush just to get you out of the door. And again, this is not the doctor's fault, it is just a massive system problem. I've worked in the NHS for many years, and this has been getting slowly worse over time. And I see this all the time, and often the quickest way to see a patient and treat them and make them somewhat happy is by giving them a medication or increasing the dose of medication they're already on, rather than talking about lifestyle measures or other ways in which they could treat their condition. And in the case of proton pump inhibitors like lansoprazole or omeprazole, most of the time people are started on it because they have heartburn or reflux. But the thing with omeprazole is that it's often given for so many things. You're given it if you have indigestion, you're given it if you're there to protect your stomach from taking painkillers. And a lot of the time, these medications, you don't need to be on long term, and the patients aren't told about this, and you're not told about what happens when you come off them and how your symptoms might initially get worse. Now look, firstly, I want to caveat all this by saying, look, there are some conditions where you do need to be on a PPI long term, like Barrett's esophagus or Zollinger-Ellison syndrome. But other than that, there are very few that you need to be on long term. And I think we give omeprazole and keep renewing it because of we think it's not going to give you many side effects. But the crazy thing is it will, and it can, and I've seen it happen before to patients. But firstly, omeprazole is a proton pump inhibitor, which means it reduces the amount of acid your stomach makes, which in theory reduces your heartburn and reflux symptoms. And this is great, it does the job, it makes your symptoms better. But the thing is, our stomachs are meant to be acidic. They're acidic for a reason, and it's to help with the digestion process by helping you absorb all the nutrients you need and by breaking down the food that you eat. And the thing is, if you're having ongoing symptoms when you stop the medication or even when you're taking the medications, you need to be investigated further. Often what happens is you'll come in and you have these symptoms, and we might do a blood test or a poo test to look for something called H. pylori. And if this is positive, then you get started on antibiotics and a PPI like omeprazole, for 6 to 8 weeks or even longer, depending on your results. But if this is negative, patients often still get stuck on a PPI to help with their heartburn symptoms. No, but here's the crazy thing. Once you stop a PPI, your body responds by producing more acid. Because think about it, you've had all this time when you've been suppressing your acid production. So when you stop the medication, your body thinks, oh, what's going on here? I'm going to react by making loads of more acid. And the problem is this hypersecretion gives you very bad heartburn and reflux. And often these symptoms are often a lot worse than before you started the medication. Therefore, you think, oh, what's going on? You call up the doctor, and then you get put on omeprazole again, and this is how patients get stuck on them. The thing is, right, here's the crazy part. If you take it for 3 months or more, the chance of magnesium becoming low is very high. And magnesium is super important. It's involved in over 300 chemical reactions within your body. So it can be a significant thing, and you will feel it. This can make you feel tired all the time, have low energy, cause mood swings, make you more irritable. Also cause muscle twitching, shaking of your hands and arms, and a very fast or irregular heartbeat. And if you start taking longer than a year, the chance of this happening is very high. And also longer than a year, your risk of getting very low B12 levels, again involved in energy and metabolism, and the risk of you having bone fractures does increase, as does having more gut infections. And you can get something called SIBO, which is small intestinal bacterial overgrowth, which can give you some nasty symptoms like nausea, vomiting, diarrhea, and pain. The thing is, to explain this to a patient takes time and explanations, and they may well have questions. And in the current state of the health system, there just isn't the time for that. So the patient isn't aware of this before they start it. And it makes you wonder, if they were aware of it, would they want to take it? And it's my job as a doctor, your job as a doctor, to try to explain to them what the pros of them are taking it are, and what the negatives are. and support them in making a decision, like you would with any medication. And look, another one people ask about or are aware of is cancer and the chances of taking a PPI, increasing the chances of you having stomach cancer. Now, there is a very small study on that where the chances of that happening are very, very marginal. But that's not the main issue. I think the main issue is that omeprazole can mask a cancer, because one of the most common symptoms of cancer in the GI tract is heartburn and reflux. Therefore, if you're treating that symptom, you can often delay diagnosis of this, which obviously affects your prognosis. But now, look, I need to balance this out by saying, look, there are some conditions in which you do need to take this long term. And actually, sometimes it can prevent getting cancer, because you can get something called Barrett's esophagus, which is when the acid goes up into your esophagus and changes the lining of the cells of the esophagus into a precancerous state. And in Barrett's, if you don't reduce the acidity of the esophagus, that can turn into full-blown cancer. And in these patients, a PPI is needed long term. But the purpose of this video is to say, look, most of the patients I've seen do not need to be on a PPI long term. The only reason they're on it is because they started on it for something a few years ago, don't know why they're on it, and now they can't come off it because they get really bad rebound effects. So if you're one of those people that's on this medication, and if you don't know why, please ask your doctor why you're on it and if you can taper off it. Because if you do try and come off it, it can be very difficult. I warn you, I pre-warn you. And sometimes we have to say to you, look, you're going to get rebound symptoms. You just got to fight through them. And then we talk about lifestyle factors, about how you can reduce, acid in your stomach. There's lots of things now, not just lifestyle. There's new, medical devices out there that can really help. And there's lots of alternative therapies as well that can help without using medication. And I think this is something we need to be aware of and explain to patients. I think I'll do a video on it next, actually, about how you can reduce stomach acid without medication, because I think it's something we don't have enough time to discuss with the patients. But look, if you like this video, let me know. If there's anything you want me to discuss, please let me know. Leave a comment maybe. I do a lot of short form stuff on the other channels, but I think, and I've got a podcast on YouTube, but I think I'm going to start doing more videos like this in clinic when I see patients about things that I think people need to be aware of that they may not be aware of. Because I think ultimately the goal is to spread education and make patients aware of things that they may well not know. Because let's be honest, I think in this day and age when you can't see your doctor, knowledge is power, and knowing what questions to ask is very important. So yeah, I hope you found it useful. Please leave a comment if you liked it. Take care. One more thing before I go. I think also another main point of this video is to make sure that we try and find the root cause of what's going on, because a lot of time we give you a treatment that just covers the symptom, right? But especially with heartburn and reflux, there's normally something underlying all that, and we need to dig deeper. If you don't know what's going on, if you're on a medication, be persistent. We need to know what's going on, and we need to help you and treat you. So yeah, if you don't know what's going on and you're taking the medication, ask your doctor to dig a bit deeper, because we will. We just need to know, and sometimes that's the problem right now, is that we don't follow up patients maybe as often as we should. So please, if you've got a symptom, it's not better, reach out to your doctor and ask them to dig a bit deeper because you're not feeling better. All right, I'll see you now.